visit from the Tooth Fairy can be a magical moment for any child. Pero paano naman yung first visit to the dentist? Well, that's a totally different story. As adults, we already know how to take care of our own teeth. But when and how do we begin dental care for our kids? At pagpanahon na ng first dental checkup nila, how do we make it a good experience for the whole family? Well, to help us figure out those childhood dental do's and don'ts, please welcome back Dr. Raemund Galang and Dr. Camille Corvera-Galang, of the G Dental Group. What's up, Docs?
Hi, Miss.
Hi, welcome back to the show.
Yes.
So this is a great topic for all of our Canadians out there with infants, no? I mean, none of us really remember having baby teeth, but apparently they're important. Bakit ba?
Very important, yeah.
Baby teeth are very important. Well, for the very obvious reason of, we use them to eat,
Siyempre,
to learn
kailangan
how to
nila
speak,
kumain yung mga
to
kids.
smile. But also they are very important for the position of the permanent teeth. If the baby teeth are lost early, for example, may infection, it can damage the permanent teeth that might come in after
So
that.
you want to make sure you're taking good care of those baby teeth as well.
And if they're pulled out early, then they start moving into the space, hindi na makakalabas yung adult
So
teeth.
naka-crowd yung adult
Exactly,
teeth. So they're like spacers, kumbaga.
Exactly.
Okay.
And what parents don't realize is baby teeth stay in the mouth until 12 years old. So that's a long
Wow.
time. Yeah.
So from a dental perspective, when should you have your child seen na by a dentist to make sure that these baby teeth are healthy?
Good question. The ADA actually recommends that you see the dentist as early as the first baby teeth come out.
Which is when?
Which is normally around 6 months.
Wow,
okay?
6 months pa lang.
Yeah,
Exactly.
yeah. So
Okay.
5 to 6 months to 7 months, but that's the average.
They'll start coming out. And then you'll have all your baby teeth at around 2 to 2.5 years old.
Okay.
So by that time, dapat nakita na sila ng dentista. Or else you can imagine kung puro sira na sila. By the time you see the dentist, then ang laki-laki na ng dental bills nyo.
Oo. Kasi may complications na. Anong pwede gawin ng mga parents to ensure that the baby teeth stay healthy?
Well, first is when the first teeth come in, they can use a toothbrush, or if they're too young, they can actually just pick up a gauze. Let's pretend these are the baby teeth, and they literally just rub the baby teeth when they're sleeping after they're fed at night.
I see.
We always also want to make sure that they wean their kids off the bottle as soon as possible.
Yeah.
Why? What happens with the bottle?
A lot of times, especially mga, I remember when I was growing up, pinapainom pa ako hanggang malaki na ako. Pinapainom pa rin ako sa bote, but that's not the way you want to do it. The reason
May
is...
mga pinsan ako na ganyan, hanggang mga 4 years old sila.
Nakabote pa rin.
Kasi parang walang spill, di ba? Mas madali para sa yaya.
And they're thinking kasi, syempre, gusto nilang palakihin yung bata. They want to give them all the milk. But what's happening is, their teeth are being saturated by the milk.
So while they're
nagrarot.
sleeping.
Yes.
Right.
And I know that you have pictures here, no?
Correct.
Of what it looks like.
Yes.
Medyo nakakatakot talaga sila, Canation.
Yeah.
After you see these, parang gusto mo talaga silang sipilyuhin every night for the rest of their lives. Well, sige, let's move on. This is what I love about you guys. Ang dami yung props.
Of course.
So on the first visit to the dentist, now that you brought it up, no, ano yung mga pinaka-do's and don'ts natin?
Number one among Filipinos, don't scare your
Oh my
kids.
gosh, yes. A lot of times, di ba, yung mga parents or syempre, nasabi nila, okay, don't be a bad kid or else you're going to dadalhin sa dentista, dadalhin sa doktor, i-injeksyonan kita. So, a lot of kids, wala naman silang concept of fear. Hindi naman nila alam yun. Pero bago pa sila makapunta doon,
to them by the adults.
Kasi baka takot din yung parents, di ba?
Yes, exactly.
So, nangyari, hindi pa sila pumupunta ng dentista, takot na sila.
So these look like some tools
right,
to help,
this is personally what I always recommend to the moms, for them to bring their kids to the office. Before doing that, kids love storybooks, right? So for example, these different books are available in stores, but I got these from the library, so they can access this anytime.
So you don't have to buy it?
No, just borrow from the
Hiramin mo na
library.
lang, okay.
And then for example, like this one, it shows, you know, what the kid might expect in a dental office. There's a chair, there's a light, and there's a person gonna check your and count your teeth. You know, it's fun. You're gonna feel different things. Some are tickly, and some there's water, and
So
there's air.
basically, make it a positive experience.
Exactly.
Yes.
And it's all
Not
about
something
making
scary.
the kid familiar with what he's gonna expect in a dental office.
Para kampante na siya.
Exactly.
Okay.
Yeah.
So ano naman to? Ito ba yung mga reward for the children? Pag nakadating na sila sa
Not
dentista?
necessarily.
necessarily.
Well, we just brought a few common drinks that your kids might be having during the day.
Box
Oh.
juice.
Yeah, juice boxes,
Juice box, sports drink, and cola.
and sodas.
Okay.
Yes.
And this?
And you'll be surprised how much sugar there is in these products. Okay.
Oh
like
my.
this is 10 teaspoons of sugar.
10
which you can find
teaspoons
in
of
a
sugar.
can of soda.
And
So
that's
this
typical.
is this, basically.
Yes.
Maski rin ba kung NutraSweet yung gamit nila sa soda, kunyari kung diet drink sila?
Then
Diet-
that's better because there's no sugar in it, but they still contain a lot of citric acid.
So nakaka-rot pa rin.
Nakaka-erode pa rin.
Nakaka-erode
Yeah.
pa rin.
Right.
Okay. So, keeping away from these,
Yes.
what other tips can you give our parents para mas painless ang teeth growing experience nila?
Well, of course, at the age of 6, they start to have their permanent teeth. Okay, and some people don't know this, and most of the permanent teeth will normally come from the back, okay, and from the front. So you got to make sure that natisipilyo rin ng bata yung ngipin sa
All
likod.
the way to the back.
Exactly. Kung hindi, syempre magkakavities ka. Now, what we can do in our office is we place sealants on these permanent teeth. Sealants are like plastic resin that we paint over the teeth. That way, it's hard for the bacteria to penetrate and hard for them to get cavities.
Parang may varnish sila
Exactly.
on the molars.
Exactly.
It's very
Wow.
easy, you know, it only happens in a couple of minutes.
Yeah.
So it's
very easy
pretty
for the kids.
painless.
Oh,
Pretty much,
definitely,
really.
definitely.
And last but not least, no. I know that you guys do a lot of work with kids. Actually,
Yes, we do.
nagvo-volunteer kayo at schools.
Yes.
Yes, we do that. We even help with the oral assessment of kids in the county of San Mateo. So,
Oh,
yeah.
that's great. Well, why don't you tell our Nation where we can find you kung may mga tanong sila or kung magbibisita na sila sa inyo with their children.
Sure. Well, our office is located at 901 Campus Drive in Daly City. You can visit us at our website. It's www.gdentalgroup.com. Hope to see you there. And please, you know, you can email us for questions or suggestions. Maybe the next question we can actually discuss it here.
Yeah,
on
that
Nation.
sounds great.
Diba?
Well, thank you very much, Drs. Galang. It's always
Thanks,
very nice to
Mishi.
see you here.
Thank you so much.
All right, and best of luck sa lahat ng mga Nation na may bata. Please do check them out kasi medyo mukhang sanay na sila with your kids. All right? All right, well, let's start off our kids right, keeping their smiles healthy and bright. Don't go away yet. There's more Adobo Nation when we come back.